Thank you, everyone, for taking the time to join us today. From the Legislative Building in Regina, we will have Health Minister Paul Merriman and SHA CEO Scott Livingstone. On the phone from the SHA, we will also have Derek Miller, Emergency Operations Center Commander. We'll start with opening remarks from Minister Merriman.
Thank you and good afternoon. We are now 1 week into our new vaccine appointment system, and things are working extremely well. We've had over 66,000 Saskatchewan residents have called the toll-free number or gone online to book their appointment. The pace of vaccines in our province continues to increase thanks to the tremendous effort of our healthcare workers. And thanks to everyone who has taken the time to book your appointment or visit the Regina drive-thru and get your shot. Every time a healthcare worker gives a shot, every time a Saskatchewan resident gets a shot, you're making Saskatchewan a safer place for everyone. So thank you. Yesterday, 1,900 shots were administered at the Regina drive-thru clinic, our highest one-day total to date. We are reporting a total of 5,430 shots administered province-wide, also our highest total to date. Saskatchewan now has the highest per capita rate of vaccines administered in any province, just over 10,000 per 100,000 people. These numbers are only going to increase in the days to come. Today, I am pleased to announce that we have moved into phase 2 of our vaccination plan, which opens the appointment system to people under the age of 70. Phase 2 will eventually include everyone. But we are going to keep opening appointments up incrementally by descending order of age. As of right now, anyone age 67 and older can go online or call the toll-free number and book an appointment. We will be opening it up to more age groups just as fast as we can, based on the number of vaccines and the appointments that are available. So I would encourage everyone to check the Government of Saskatchewan's COVID-19 website or the SHA's website and social media feeds often to see when exactly you can get your booking appointment and then book it. For everyone 67 and older, you can book right now. And there are still some appointment times open at some clinics in the next few days, even tomorrow in some locations. So I would encourage everyone, when you're eligible, go online, call the toll-free number, and book your appointment. We're encouraging everyone to book their first available appointment just as soon as your age group opens up. Sometimes that appointment will be during the work week. That's why our government just enacted new regulations giving every employee up to 3 hours paid leave from work to receive their COVID-19 shot. Every employee who gets vaccinated makes every workplace just a little bit safer. So this is one more way to ensure that everyone has the chance to get their shot as quick as possible. Phase 2 of our vaccination plan also prioritizes individuals who are clinically extremely vulnerable. A complete list of clinically extremely vulnerable conditions is available on the government's COVID-19 website. Saskatchewan residents with one of these conditions will receive a letter with instructions for booking their appointment. Phase 2 also prioritizes congregate living settings like group homes and emergency shelters. We will be working to vaccinate those residents and staff as quick as possible, primarily through our mobile clinics. Province-wide, new cases continue to gradually decline. The 7-day average is now 128, which is the lowest it's been since November 13th. However, Regina continues to have a higher case number and more variant cases than the rest of the province. That's why we're urging everyone to be particularly cautious in Regina. And that's why we have increased our focus on vaccinating more people here in Regina with the drive-thru clinic. Thank you again to everyone in Saskatchewan for all that you are doing. Please keep following all of the public health orders and guidelines. And when it's your turn, make your appointment and get vaccinated. Thank you.
Okay. Thanks, Minister. Good afternoon, everyone. As we move into the next phase of our immunization program, we need to continue with all the precautions that help keep us safe and follow public health orders. This is especially true with the variants of concern circulating across the province. These are more transmissible and potentially more harmful, so it's critical we continue our efforts to fight this virus. That's why I'm pleased today to join the Minister in marking a significant milestone in our effort to fight the pandemic. As the Minister stated, we started today booking those in Phase 2 of our COVID-19 immunization campaign. We're also reaching out to those in our clinically extremely vulnerable category, as well as those in group homes and other congregate living facilities to facilitate their access to vaccine. Community-based organizations and other organizations serving vulnerable populations that fit these categories will be receiving communications in the next few days on plans for vaccinating those they serve in their area. This is an important milestone. I do want to stress a few points about the milestone, however. First, I'd like to acknowledge that there is some overlap between Phases 1 and Phase 2. While everyone in Phase 1 has had booking open to them, we know that there are still some of those who have not booked appointments. This is a natural overlap that was always expected. Doing so ensures that we're making every effort to maximize the capacity that we've built to get vaccines in arms as quickly and as safely as possible. We built an immunization program that is capable of continuing to lead the nation in both its speed and its safety. But we need continued high volumes of vaccine, and we need to ensure people are continuously booking into our system. And if you're in Phase 1 and for some reason you haven't booked yet, please keep in mind that once you are eligible, you are always eligible. Second, I'd like to assure the people that going to 67 and over is just the start. In a very short period of time, we will lower this age to ensure available appointments are filled. And we will do so again and again as supplies allow. I'd like to ask for patience as we manage some of the ongoing change and aggressive timelines of an immunization program of this size and scope. Fast-paced change does not always lend itself to clear communication. Multiple different vaccines available in different ways and formats can also add to public confusion. But our main goal is clear, and that's to give every Saskatchewan resident access to the vaccine as soon as possible. And that's a goal we all share. So please bear with us as we take out the wrinkles in the process and be assured that we continue to deliver vaccine as fast and as safe as possible. I'd like to end, as the Minister did, in thanking healthcare workers who are making this possible. The milestone we're hitting is a good reminder to us to thank them for their sacrifices as they are making huge efforts to keep us safe. Thank you.
Thank you, Minister. Thank you, Scott. We'll now move to questions. Start in the room. Lynn?
Sure. Do you know how many people are in those kind of priority groups for Phase 2, I guess, like group homes, like critically vulnerable, like those types? How many does that cover?
So we do, Lynn, and Derek Miller, our Chief of the OC, is on the line with us, and I'll let Derek answer that question.
Hi, Scott. Sorry, I wasn't able to quite pick up that
Yeah,
space
so
on
Derek,
the audio.
Derek, the question was how many people are in the extremely vulnerable group, like the category over and above the 67 plus?
So the clinically extremely vulnerable group has about 25,000 individuals identified to receive letters as we move into Phase 2.
Thanks, Derek. Lynn, do you have a follow-up?
Yeah. So like we're hitting Phase 2 faster than expected. What are you, like, does this change the timeline you've laid out for the rest of the vaccine delivery plan, especially with potentially more like vaccine doses coming than anticipated?
Yeah, it sure does. We've seen an increase in the amount of vaccines that the federal government, when we rolled out our plan a few weeks ago, those numbers have increased, which is a good problem for us to be able to manage. So we have increased our timeline based on uptake. We've had very, very good uptake in every age category. The drive-through that we've added in with AstraZeneca here in Regina for 60 to 65 has gone extremely well. So it does accelerate our timelines a bit, and we're happy to be able to roll this out Phase 2 a few weeks early.
Take another question in the room. Colton?
Yes, just pulling it up. So does the province have plans in place to proactively test in schools using rapid test kits in an effort to get in front of the variant spread?
Yeah, I could start on this one. Absolutely. We've been working with our partners in education through the ministry and the SSBA to be able to make sure that they have all of the tools needed. We're looking at getting those tests out, but there has to be a third party to be able to administer those tests. So we are continuing to work with them, and I don't know, Scott, if you have anything else that you want to add to that?
So I'd just like to add, and I know Dr. Shahab is also on the line, but just to remind that we've always had our more fulminant testing capacity across the province. As you know, typically what we're seeing in schools is what we're seeing in the community for cases. So we've always had that there, as well as when there are cases in school, we know the schools are in direct contact with medical health officers locally to get advice. And if there is an outbreak, public health is there as well on site to deal with any concerns and address those concerns, as well as arrange testing for those students.
More variants becoming available, will there be an opportunity for people to have a choice between, vaccines? Will they have a choice between vaccines? And if not, do you have any message to people that want a choice?
I would say take the first vaccine available to you. They're all very good quality vaccines. I have said that I would personally take each one and would have no problem giving that to any member of my family. So I would ask them, right now our demand for the vaccine, it certainly outweighs the opportunity to have options. But the AstraZeneca that we have, the drive-thrus, the Moderna and the Pfizer are all good quality vaccines. And you won't know what vaccine you're getting until you actually get into the facility to be able to get that vaccine. So they're all good quality, and take whichever one you can.
Take our next question. Steph?
So am I correct to understand currently there's no rapid tests in any schools in this province?
Sorry, could you say that?
No rapid tests being used in any schools in this province as of right now?
I'd have to check into that to see if there are actually any tests that are out there, but they are available. We're working with our school partners to be able to make sure that they want those tests in their facilities. It's kind of division by division is what we're looking at. So again, we're going to continue to work with them to be able to find out if they want them. Some of the school divisions have expressed interest in this, but they have to have somebody there to be able to administer the test. It has to be done in a proper way. Otherwise, we could get a false negative or a false positive on that. Dr. Shahab, did you have anything that you wanted to comment on that?
Yeah, thanks. So, we have always had, strong relationships between local public health and SHA and schools. So even before point of testing is deployed more comprehensively, the SHA has been, Saskatchewan Health Authority and public health have been supporting schools if enhanced testing is required, if there's an outbreak or other concerns. And right now, even though the variants of concern are quite a significant issue in Regina, and occasionally they've showed up in other schools like in Yorkton and Saskatoon. At the moment, the current processes are sufficient, and schools are just reflecting transmission in the community. So it's a very low transmission overall in Saskatchewan, concerning transmission in Regina. But of course, further access to point-of-care testing over time will be an additional benefit, an additional layer of assurance, not just for schools, but workplaces and other sites that would want to use that as a quick way to screen a large number of people. But again, at this point, the processes that we've had ever since September are working well, and public health is working closely with schools, especially in Regina, but throughout Saskatchewan. And we have to remember that, at a basic level, there's no difference in terms of how we prevent getting exposed to or exposing others to COVID, whether it's variant of concern or otherwise. And then if we do test positive, even though the variant of concern diagnosis may not be immediately communicated, may take several days, both the SNP assay and the whole genome sequencing, which comes much later, the response is exactly the same. The concern is high because of higher transmissibility, but everything we need to do to prevent transmission is exactly the same. So, plus, of course, now in Regina, there's some additional follow-up of contacts who may require further testing before they can go back to school or work. So some additional protocols are being put in place as an additional layer in communities where VOCs are the dominant strain, and that's mostly in Regina. But that's not a school-specific measure, that's a community-wide measure. Thank you.
Follow-up, Steph?
Minister, vaccinations don't provide overnight immunity, and currently in Regina, they're only open to select age groups. So why is that your government's main strategy for dealing with an increasing variant spread in the city versus stronger public health measures that would force people to cut down on social interaction?
Well, I would say that we still do have very strong public health measures. We've only changed one public health measure in Saskatchewan since mid-December, so they are very stringent public health measures. And I think that, coupled with the vaccine deployment that we have had in Regina, the normal vaccine deployment plus the extra vaccine deployment, and I understand that there is a time lapse between when you get vaccinated and when that vaccine has fully impacted your system. But these are all tools that we're able to do. Again, the mayor came out, the premier was out on Tuesday to be able to talk to everybody about compliance with that. And I feel that the people of Regina will be able to comply with that, complemented with our vaccines, but also maintaining all but just changing the one restriction.
Take our next question. Adam?
Just following up on Steph's point there, there's a study out today that shows that Saskatchewan had the least stringent restrictions of any province, and leading in per capita rates for the country. It continues to. Now we have a variant spreading in Regina. Dr. Shahab just called it concerning, and nothing further has been done as far as public health measures in the last week or so. So can you explain to the people why what the government's doing is going to prevent further spread, other than asking people to do their best?
Well, I think we've seen before, and Dr. Shahab might have a comment on this, we've seen when we asked people to be more compliant in December, the numbers actually trended in. Our numbers were trending in the right direction. There was call for increased public health measures restrictions at that time. We chose to hold what we were doing at that point in time. No reason to think that it won't work. The weather's nicer. People are going to be getting outside. They're not cooped up in their houses. We've got our vaccines. We have testing capacity. If people are feeling ill, that they can come in and get tested. We feel that the public health measures at this point in time are sufficient. Now, that might change. That could change in either direction, depending on what our numbers are and what the variants of concern are in Regina. But right now, we feel that the numbers are starting to stabilize across the province, and I really feel that the people of Saskatchewan and certainly of Regina will comply with the public health orders, as they have in the past.
Why are we moving to phase 2 right now when 20% or so of people in phase 1 haven't yet booked a vaccination?
Well, we actually have every age category that we've seen about 80% uptake of each age category coming down from our highest age category to 70. We've had either people that have been vaccinated or have booked their vaccination. So we want to keep the vaccine lines full. We want to keep the appointments full so we can get through this again as fast as we possibly can. So that's why we're opening it up, because some of the appointments, like I mentioned in my opening comments, there's still open appointments tomorrow. So I would encourage anybody that's over 67 to book their appointment immediately. And as Scott had mentioned earlier, if you're 75 and you haven't booked your appointment, please call or book online and book your appointment, and you'll be prioritized. So we want to make sure that everybody has the opportunity to be able to get in. The increase in vaccines that we've seen come into the province is why we're moving faster through our age course.
So I'd just like to add a little bit, Adam, if that's okay. So of course, our ultimate target is that everybody in the province gets the vaccine and takes it as quickly as possible. But we know that's a stretch target, and to have an 80% uptake of vaccine at this point, and Dr. Shahab would want to comment, but relative to other vaccination programs, that's very high. And we want it to be higher, but at 80%, I'm not sure if we can expect more than that at this point in time in the program. But Dr. Shahab, do you have any comments around sort of what 80% looks like in an uptake an immunization program?
Yeah, thanks. So, right now, I think the age-based vaccination program is primarily providing clinical protection to the most vulnerable, starting with the oldest and then working the way down. And of course, clinically vulnerable, there'll be further communication going. And then, of course, prioritizing individuals living in congregate living settings, again, going down by age groups. So I think it's addressing both higher clinical outcomes as well as risk of high exposure, especially in congregate living conditions. So I think, it's meeting those initial priorities. But we have to recognize that, throughout the pandemic, people who are more likely to get COVID are those who are out and about working, public-facing jobs, and that's certainly true currently in Regina, that the bulk of the COVID-19 cases, even VOCs, are in, the 18 to 49 demographic. But obviously, while, serious illness can happen in anyone, illness is generally milder in that age group. But still, we need to continue with public health measures and all of us, schools, workplaces, until, all of us have received 2 doses. But ultimately, by June, July, we really are looking forward to a high uptake. And like Scott said, 80% plus uptake at a population level would be ideal. At a clinical level, it protects you, your family, others close to you, who may not be fully protected themselves because they may have immune suppression. But at a population level, 80% is what we want to aim for. And again, we shouldn't worry too much about uptake in 10-year age groups initially, because sometimes people it takes some time for everyone to make up their mind and get vaccinated. But over time, I think we do want to see a high uptake. And, I'll say it again, as residents of Saskatchewan, we need to continue to challenge the Saskatchewan Health Authority to make them run out of appointment slots and vaccines, and really create that demand, because that way we'll get vaccine quicker into our arms. And, individually you have some protection 3 weeks after the first dose, but then 2 weeks after the second dose you have full protection. And already evidence from other countries is showing the benefits of that, and there's declining case numbers, primarily in the age groups who get fully vaccinated, but then overall in society. Thanks.
Shifting gears, we'll take a few questions on the phone. Operator?
We have Laura Fominov with CKOM.
Hi there. What are the instructions for those who are extremely clinically vulnerable? Why are those letters being sent out to them, and why are they required to book an appointment?
Well, because we have an appointment-based system, because we chose to go with age categories, starting from the oldest down to the youngest. The letters are going out to be able to make sure that they have some verification when they do the call-in, and anybody that receives that letter will have instructions. Our online system is strictly age-based, so if you're not 67 or older right now, it will not allow you to book. So that's why we're asking people that when they get this letter, please call in to the phone number 1-833-SASK-VAX, and when they come into their appointment to actually have their vaccination, present that letter, and that will allow them to get the vaccination at their scheduled time.
Follow-up question, Lara?
Yes, please. Also, are those who are identified as extremely clinically vulnerable more at risk for side effects from any of the vaccines?
I'd have to get Dr. Shahab to touch on that, but we're asking any individual that feels that or wants to get a vaccine that is in that immune compromise to contact with their specialist to be able to make sure that they should get that. And Dr. Shahab, did you have any comments?
Yeah, so for most clinical conditions which may place you at higher risk of severe outcomes from COVID, there's no difference in terms of any contraindication or concerns with the vaccine. Early on, because the initial vaccine trials had not been done in women who were pregnant or in persons who had immune suppression or autoimmune disorders, there was some extra caution. And certainly people who are on, specialized immune suppression therapy are already being advised by their physicians that, what to watch for, or whether any adjustments in your immune suppression therapy has to be done prior to the vaccination. So, those individuals which are on specific immune modulating immune suppression therapies are already working with their clinicians so that to optimize when they get the vaccine, and so that the vaccine shows, the full benefits. But if there's any other concern, certainly, people who are on that list should keep in touch with the specialists or family physicians for further guidance. But generally, the vaccine is safe, effective across all age groups for which it's licensed, 18 and older, and it actually we all know that if you have immune suppression or other conditions, sometimes vaccines don't work as effectively, but certainly the COVID vaccines are working, very effectively in spite of underlying health conditions. And that's why it's really important for all of us as we become eligible based on age or underlying risk factors to get the vaccine earlier rather than later. Thank you.
Take another question on the phones.
We have Lisa Schick with CJME.
Hi there. I have to apologize if this has already been asked. I'm having a little trouble hearing the questions in the room. But I just wanted to ask, you've opened up the part of the second phase because there are still appointments left. So can you say how many of those in the first phase haven't booked, if you have any numbers on that? And is that number a concern given the interest in getting as many people with the vaccine as possible to kind of have societal protection?
No, that's exactly why we opened it up, because we did have some appointments that were not filled, but I'll get Derek to probably answer the exact number of appointments that we do have in the system right now in the next foreseeable few days.
Hello, it's Derek here. So just since opening up the online and phone lines to the 67 plus here today, we're approaching 80,000 appointments booked since we went live on the 11th last week. We do have ongoing availability looking out over the next about the next 2 or 3 weeks with clinics established that people can book into. And we'll continue to build those out as we get vaccine supplies confirmed, looking into the month of April.
Scott?
So Lisa, just to answer the other component of your question is, when you ask what percentage of people aren't uptaking the vaccine, so we know 80% within the age groups are, so it's 20% that aren't taking the vaccine appointments at the same time. And when we are opening up that age group to booking appointments, what we're seeing, overnight, a great flurry of activity of booking, and then it starts tapering off, and we start hitting that 80% or getting close to that 80% mark, and that's when the age groups are opened up to the next level. So that's really the trigger, and we do know that people are continuing to book after the first day that they're eligible, but those are the numbers.
Follow up, Lisa?
Yes, my second question is regarding people's second shot. For the people who are getting their shots now, and particularly those going to the drive-through clinic in Regina, what's the procedure for them getting their second shot? Are they being given a date at the time? Are they going to be contacted? And are they being told to wait the full 4 months, or can they decide to get it whenever after they're eligible?
The second shot will be done once we get the majority of people done on the first shot. Our priority is to get that done, excluding long-term care and personal care homes, which are getting both shots. It'll all depend on the vaccine supply over the next little while, how fast we get through the categories. We're ahead of schedule as it is right now, and there's nothing that indicating that we won't continue to be ahead of schedule. So the faster we can get done that, but if somebody comes up to that change where it is 120 days now, then they will be scheduled for their second shot, and we will open up the system, and it's online, or they can do it by the phone, and they'll know what they got on their first shot and their second shot. On the online application, it'll come up and it'll say second dose, and it'll know exactly when you're eligible, and it'll inform you when you're eligible.
Take another question on the phone.
We have Connor O'Donovan with Global.
Hi there. Just wondering, after we saw, vaccines will become available for those in group homes and those extremely vulnerable, I'm wondering if there are any other groups that are outside of age-specific brackets that you're considering prioritizing vaccinations for in the coming days and weeks.
It'll mostly be congregate living in shelters and group homes, but also there's a list of the immune compromised on our website. I don't have the list in front of me right now, but there is a very comprehensive list of what that category includes from when we get into phase 2.
Follow up, Connor?
Yeah, I mean, beyond that, we saw promises talking about prioritizing teachers, grocery store workers, other sort of non-healthcare frontline workers. Is there any consideration to vaccinating those parts of the population or giving priority to those
We did. We have prioritized healthcare workers. They were the first ones that were done in the province, and they were prioritized in phase 1. We've also added in healthcare workers into phase 2 in this category right at the beginning between the 60 to 69. So we actually have a lot of individuals that are in this first part of phase 2 that are getting vaccinated. That's why we wanted to open it up fairly slowly and do it into 2 to 3 year increments, because we didn't want to overload the booking system. So once we get rolling through that, we'll start, we'll open it up to some future or some younger people within that age category, the 65 to 67, and then and keep going down from that age across the province. But in order to that, this is what we've done right at the beginning, is we decided to go by age categories with a few exemptions of healthcare workers, people living in group homes, people that are immune compromised. This is the fastest way to get out the vaccine across the province, is to be able to roll through the age categories. And we have heard some very positive comments about the vaccine clinics, the drive-through here in Regina, that it's been run very efficiently by the SHA. They've done an amazing job of doing that. So again, the fastest way to get through this, and why we are rolling through our age categories so quick, is because we chose to go this direction.
Take another question on the phone.
We have Brian Zinchuk with Glacier Media.
Hi, I was wondering, we haven't really heard a lot about kids and students, especially with regards to, first of all, I don't think anything's been approved for them yet, and how long those approvals will take. What is the province's plan for getting students out? Because we're hearing from the NDP, for instance, this morning about the education system and teachers and whatnot. So what are your plans to get to that age group?
Well, I'll touch on just the age group. As far as I know, Moderna is approved to 16, and I believe Pfizer is approved to 18. But Dr. Shahab may be best to comment on that, but they haven't done enough clinical trials to get into that lower ages of our children in our province. Dr. Shahab, do you have a comment?
Yeah, thanks. I think that's a really important point. So right now, the allocations that we are receiving are for 18 and older, and the vaccination program is primarily for 18 and older, 2 doses, hopefully by July, as supplies allow. But again, currently trials are occurring, in that 12 to 18 age group, as well as in some cases they have started in that under 12 age group. And so based on the clinical trials, there'll be an assessment that once you have achieved population level immunity in adults, which we will hopefully achieve by July, the additional, not just the safety and effectiveness of the vaccines, which likely the trials will show that they're as safe and effective in children as they are in adults, but the additional benefit of vaccinating, school-age children and preschool children. And if the benefit is clear, which it may well be, that program will start once, the NACI has made that recommendation for those age groups, and vaccines are available for those age cohorts. But obviously, no country in the world right now has approved vaccines for, as far as I know, in that under 16 age group. But obviously, both the approval of vaccines in that age group, as well as the further benefit of vaccinating that age group will be important. And we have to remember that while COVID can really be a serious illness in everyone, especially in younger people with significant underlying comorbidities, obviously, thankfully, school-age children, while they may get, in many cases, asymptomatic infection and may, but they are less likely to transmit and less likely to get serious. But that's something that we will be watching closely as the trials proceed and as NACI recommendations come, likely in summer. We don't expect anything earlier than summer on this age group. Thank you.
You have a follow-up question, Brian?
So I guess surely you must have war gamed when you do have approvals, how you're going to implement this. I mean, are you taking it down to schools?
Yeah, so, when H1N1 came, obviously at that time, young people are impacted more than seniors. If you remember in 2009, H1N1 impacted young people more than seniors. Seniors had underlying immunity to H1N1, 65 and older. So we had a reverse vaccination program that was very successful. And, whenever we have a vaccine targeting, young school age or preschool children, that's the population for which we already have a strong infrastructure through school-based vaccination programs and public health clinics. So again, it'll depend if, the capacity is certainly there to vaccinate all children in school fairly quickly, but if required, obviously, pharmacies, physician offices can all assist. And, a program that's right now is already addressing, almost 67 and older are being vaccinated. That's almost, 4 10-year age cohorts. So certainly the capacity would be easily there to vaccinate, children 18 and under once approved and the vaccine is there. Thank you.
And we'll come back to the room for a few more questions. Steph?
Minister, the Premier said last month that rapid tests should have been deployed in schools sooner, and the school year is almost more than half over. So I guess, why is it taking so long, and is it acceptable in your mind that to this date, it seems that no schools have these rapid tests being used?
Well, again, as I mentioned, it's working with the School Board Association, with the local boards to be able to see, first of all, if they want that in there, when they want it, and do they have somebody to be able to provide that. We can look at getting in some employees from SHA to be able to administer that, but that also pulls from our system within there. So as far as I understand, there's a tender out right now to be able to contract that within the school division, but we certainly are working with them to be able to manage them through that process. If they do want the tests and they have the provider set up and all of that, we would be more than happy to provide them with those testing units. But there has to be a process in place. As I mentioned before, we don't want tests coming back that are false negative or false positive, because that's not benefiting anybody.
Take another question in the room. Adam?
This might be for Dr. Shahab or someone else from the SHA, but are we seeing trends? I know there's privacy issues, but are we seeing trends with ages of those who are being hospitalized since we've seen the introduction of variants into the province?
So maybe I can give some initial comments. So we already know that the variants are, 50 to 70% more transmissible. So everything you do, you have to do better when variants of concern come. So, wear your best mask, make sure it's tight-fitting, make sure you absolutely maintain the 2-meter distance, minimize your number of contacts. And right now in Regina, what we are saying is that think of all the things you do, what's essential, what can be deferred, minimize any contacts outside your household. Outdoors always better than indoors. So that's the transmissibility piece. With special focus on workplaces, because that's where a lot of the transmission is happening. But in terms of, is it more virulent? Certainly some information from the UK is unfortunately showing that it can be up to 30% more virulent. And in the UK, we have to remember that they had already vaccinated their older cohorts when they had the third wave. So because they saw more COVID cases than they had ever seen before, because it was more virulent, even, they did see more hospitalizations in younger age groups, unfortunately. And so there's some early signals that may well happen in Canada, but obviously, right now there's, because there's, 400 plus active cases in Regina, a small proportion of individuals in every age group have been hospitalized in an ICU, and that we have seen throughout the year that people in every age group have been hospitalized, but our numbers are still too small to truly see the additional virulence of COVID-19 B117. But certainly from the UK, that's been well described now through studies. And so again, what the message is that while the risk of serious outcomes is lower if you're younger and healthier, we should never underestimate and disregard the risk of outcomes both to ourselves and to others. And the best thing we can do is maintain public health measures at all times, enhance them when we see an increase in transmission risk like in Regina right now, and of course, get vaccinated as soon as our turn comes up. Thank you.
Take another question, Lynn.
Yeah, in the news release the province released earlier, they said there'll be more clinics, like vaccine clinics opening up across the province in the next little bit. And I know U of R confirmed they're opening one of those on the 29th. Like, how many more mass vaccination clinics are you expecting to see over the next little bit here?
I'll get Scott to comment on the exact numbers, but we're increasing them as the vaccine supply comes in, and we're adding it. And we're not just adding them in the cities, we're adding them across Saskatchewan and rural Saskatchewan into the north to make sure that we're having a widespread. So the idea is when we do open these clinics that we're trying to hit the same age categories across the province and move everybody in sync. It's not going to always work like that, but that's the theory is to once these vaccines are moving around. Scott, I don't know if you or Derek have the exact numbers.
I'll start and then Derek can add. So right now, Lynn, we're running around 125 clinics across the province, and there's mass immunization clinics that drive through and some mobile clinics. And just remember, it's not one type of clinic, it's the variety, and we've built them so that if one type of clinic becomes more popular in a particular community, we can pivot and increase capacity. The ultimate goal for the SHA-run clinics is 208. And that will be an expansion of mass immunization sites, more drive-throughs. So, for example, you'll see a doubling in Regina, 2 drive-throughs and 2 mass immunization clinics, same in Saskatoon. And that will go as vaccine supplies increase, and you'll see increased volumes on a regular basis because of that. So it's really vaccine supply that determines how many more clinics. So we have had set a target for March 15th so that all the clinics, the 208 from the SHA, would be ready to go so that we could increase the number of clinics as vaccine supply increased. So just as a reminder too, there were also clinics on, with partners from First Nations, as well as retail pharmacies or community-based pharmacies that will also come online to help support the immunization program, again, as more vaccine becomes available. Derek, did you have anything to add?
I think you gave a good overview. Thanks, Scott.
Colton?
Kind of a follow-up to what Lynn basically just said is the Eastview Community Center said they will be hosting on Saturday a clinic, a vaccination clinic, no appointment needed for ages 60 to 64, along with the Mama-Way-Atatin Center. Haven't been able to confirm that. Just wondering if you're able to confirm that's true.
Yeah, so I'll let, we can confirm it, and Derek will do that for you, Colton. Go ahead, Derek. Did you hear that?
No, sorry, I couldn't hear it.
Oh, okay.
Just confirming if Mama-Way-Atatin and the Eastview Community Center will be hosting no appointment needed clinics for 60 to 64 on Saturday.
Derek, did you hear that?
I heard.
Well, I'll answer your question. Yes. So as part of this strategy with the AstraZeneca vaccine, and that's why that's the age group, and it's is to look at what other partners have the ability to vaccinate. So it was always part of the plan with the AstraZeneca vaccine and the drive-through, because of course we're taking a very large volume of vaccine and trying to get it all in people's arms by Sunday. So that we also, besides the the drive-through clinic, is to have some outreach mobile clinics for high-risk community areas where we can offer the vaccine as well for the same age group that might not be able to drive through the drive-through.
Can I ask one more quick question?
Go ahead, Lynn.
With that, it seems like we're kind of getting patchwork communication about where these mobile things are popping up. Is there across the board open communication with the community, or how will people know when these mobile clinics are popping up?
So this is one of those things that I tried to mention in my speaking notes. As we're moving quickly and enhancing clinics literally on a day-by-day basis and opening up the age groups literally day by day, it's trying to crack that nut. And how do we get that out to the community as quickly as possible? How do we raise awareness? Last night we noticed there was a downturn in the at the drive-through. We weren't seeing a lot of people come in, so we had our comms folks phone media outlets across the city of Regina and put it on the radio, and actually it works. It gets people out there. So as we, once we get into a larger pace with the clinics working, we're not going to see as much change in the number of clinics. So there'll be a more constant communication, and I know that there is a large-scale advertising campaign that will accompany the phase 2 immunization strategy. So that's going to help a lot, Lynn, is once we get out there with our bigger media campaign, it'll help raise awareness in multiple different social media and media outlets that will help improve communications in the ongoing phases.
And the other side of that, Lynn, is those community organizations are very connected, obviously, to their community. And the people that go to those will know, and they'll be communicating that out to the people that do come to their facility. So there's a very good community network in those organizations, and we'll complement what they're doing, but they already have a good reach into the system to be able to let everybody know what's going on at their specific organization.
Thank you, everyone. That concludes today's conference.
Thank you.